It's time once again for That Business Show with Jamie Meloni on 1250 Wins WHNZ, where business becomes show business. Jamie is a leading Tampa Bay real estate agent and featured on the Wall Street Journal's list of top 100 real estate agents in the nation. Jamie invites you to list your home with him today and learn more at tampabayradio.com. Now, live in studio and promoting the entrepreneurial spirit that drives the American economy, your host, Jamie Meloni.
Hey, good morning, everybody, and welcome to the Working Women Wednesdays feature of That Business Show with Jamie Meloni, where business becomes show business. This is where we highlight professional women from in and around the Tampa Bay region in the Working Women of Tampa Bay networking group, and you can learn more about them at workingwomenoftambabay.com. Jessica, unable to be with us this early morning, coming off a very successful Working Women State Conference, as you've heard us talk about many a times, and so that was this past September 8th and 9th, and an amazing event, and Jessica puts that on each and every year, so be sure to look for that every September, and just a great event to market professional women from in and around the Tampa Bay region and get them get in front of a lot of great speakers. She had like 28 speakers at that event, and so very well received event. So let's get to my guests. We got a full house today. Up first, I have Karen Pittman, Vice President of Business Development with Vein911, and many of you all are familiar with Dr. Chris Pittman. That is her husband, and so we've talked with him many times. So she is stepping into the hot seat today to discuss business development and also help sell her husband's business. So Karen, welcome to the program today. How are you doing? Doing great. So tell us a little bit about the business. You do with marketing and business development, and you've seen a lot of great results over at Vein911. Share with us some of the stories that you've seen.
Well, there's a number of stories, but first I want to start off by saying now is the time to come in. The kids are at school. As women, we put ourselves on the back burner. So now the kids are at school. Everything's settled in. So now's the time to come in. If your legs have been feeling heavy or swelling or any kind of varicose veins that you want to take care of, come in and make the time for yourself. And
I'll mention, I've talked to the doctor many times on the program, specializing in non-surgical techniques. A lot of people are familiar with veins being kind of stripped from the body surgically. He does not do any of that stuff. And
what did you call that? The spaghetti pool?
Spaghetti incident.
It is not. No, we don't do any of that. No cutting. The procedures are 30 minutes, and then we go out to dinner afterwards.
Yeah, it's all non-invasive surgery.
Yeah, I like your Guns N' Roses pun there. With the spaghetti.
There you go. Well, and go ahead.
No, just swelling isn't part of the aging process. One of our patients was complaining that she had a business trip every year to Vegas, and she would, have to buy a size larger shoe for the evenings because her feet would swell so bad, and she was in such pain. So I explained to her that ankle swelling and foot swelling is not a normal process in aging. Many of us think, oh, well, I'm getting old, my feet are swelling.
Right.
That's not. That's an indicator of venous insufficiency. So she finally came in, we did an ultrasound, and sure enough, she had venous reflux. We treated her, and she's just gotten back from Vegas, and she reported that she was in high heels all week long. She was even able to take runs down the strip, and her feet felt great. And she didn't need an exercise.
This is all related to veins in some way, and I know we've discussed ankle swelling with Dr. Pittman a number of times on the program, and it's not necessarily fully understood how some of these different conditions are related to vein disorders. We've talked about like night cramps, the Charlie horses that you get in the legs, the ankle swelling, which was what you were just saying, the traditional stuff that most people are familiar with, the spider veins and the varicose veins, and how he removes those non-surgically because he's an interventional radiologist, so surgery has nothing to do with their field of study, and it's just he's had some amazing results. I mean, you've got people flying in from all across the globe to see you all.
Yes, and one of the procedures that we do that we've become very successful and known around the world for is hand vein removal.
Okay.
He really closes them down. We don't remove them. He closes the veins down, and the body absorbs them. But we're being very successful because there's not a whole lot of people that are doing hand veins. A lot of people are doing fillers, and that's repetitive. And then it doesn't give you a smooth look because you have these filler things in there. So we close the veins down. And I had my hand veins done because hand veins are a sign of age. And when I learned that hand veins were a sign of age, oh no, it was driving me crazy. I was like, Chris, you have to do my veins. Chris, you have to do my hand veins, especially when you're driving and you see your hand veins on the wheel. And then when you're going to parties and you're holding your cocktails, The hand veins. You can look great in the face. You can be physically fit.
I think that's just something you women notice. Us men really don't pay attention to that.
Like Dr. Chris Pittman, all the time he says that we could like lose a leg and be like, I'm fine, I'll walk it off. But you're on camera, so I mean, why don't you hold your hands up towards the camera so the people watching the stream can see the results of
very beautiful
the
hands.
good doctor's work. Yeah.
Oh gosh.
And it's actually a good opportunity to ask you a little bit more about the experiences of going through the procedures and stuff like that, being that, I mean, Doc is on all the time talking about vein care and stuff.
Yeah.
I mean, we don't have the opportunity to actually talk to a patient, let alone his wife. So if you want to go ahead and describe the process, we'd appreciate it.
Sure, let's hear.
I just put my hands, you put your hands on a pillow and he injects them, and then they close down and he wraps them. You keep your hands up for a couple of hours.
And the total time that this takes?
Well, when he does the injections, which do not hurt because the injections are smaller than a hair follicle, the needle. So you really don't hurt. And believe me, if he hurt me, he would know about it.
Right.
So you keep your hands up, and for a little, for a couple of hours, and then
that's probably the most challenging part of the process, right? Holding the hands up, right?
Yeah.
Do they put you in some type of apparatus to help you hold the hands up?
He has this little thing that he wraps around your hands. Right. Nothing obtrusive, you just wrap, and then you keep your hands up. And you see what veins close down, and in a couple of weeks you come back, and if there's anything that didn't close down, he injects those. And it takes about 2 or 3 times.
Yeah. And so
and then
they're
he
gone.
Closes them down, and you
they've
look
not
good,
come
and
back
you can
or anything.
hold wine glasses and not worry about looking old.
Well, just for the record, us men really don't pay attention to that. So I think that's just between you ladies out there. But nonetheless, a great service.
Every chick I meet,
now you know that it's an indicator of getting old.
Yeah, now you draw my
like,
attention to it. So now I'm going to be looking at all the women's hands today. I'm like, all right, you need to go see Dr. Pittman.
Yeah. And first thing out of my mouth is like, you said you were 30.
Right.